Some of the hormone replacement meds, like I said, we don't get real in-depth about, so I just kind of briefly go over them. Estrogen therapy is something that has always been associated with blood clots. Any type of female hormone replacement, I would suspect and I would watch for and I would assess for blood clots. What do I mean by that? I would be assessing for DVTs. I would be assessing for PEs, stroke, MIs. Obviously, if somebody's not exhibiting symptoms of that, I'm not going to dig deep into that assessment. But so if I ask somebody and they've got no pain whatsoever, I'm not going to dive in and really bug them about their heart, right? But if somebody's having chest pain and they're on some sort of female hormone replacement, boom, that should set something off in my brain going, ooh. Or if their leg hurts. I had a patient who actually, she came in and she had a mastectomy. And so minor surgery. She was on birth control, and she was experiencing pain in her foot. So I assessed it, right? That's what we do. And as I assessed it, I'm like measuring the two sides. Oh, this one's a little swollen. This one's more red than the other one. This one's hot. You know, I'm like, talk to the doctor. I'm like, do you think she could have a DVT in her foot? She did, actually. And so, you know, just be on the lookout. You know, keep it in mind that those things can happen. And the more medications they're on, the more likely they're going to run into those adverse effects sometimes too, especially when they're on chemo and it's making everything else, all the levels go up and everything. So can happen. So a lot of times different female hormone replacements will have combinations. So here, Prempro is estrogen plus this is progesterone HRT that increases the risk of breast cancer. So also, if we look at this estrogen progestin combo decreases the risk of one's endometrial cancer, but I can tell you it increases risk of ovarian cancer. So these can also, you know, some of those sex characteristic type cancers, those gender influenced cancers, they can be influenced by hormone replacement. And one hormone may decrease the risk of breast cancer, and that same hormone might increase the risk of ovarian cancer. So it's very complex, right? Our bodies are very, very complex. They can be used with hormone replacement with menopause. Various hormones can be used in a cyclical fashion, right, for birth control. When estrogen products are used in transdermal sprays, I just want to let you know that transdermal sprays often lower the risk of side effects. So there's kind of less systemic side effect involvement when we do that, even though transdermal is somewhat systemic. In fact, it is, but we do decrease that risk of some of the side effects. In general, estrogen therapy can cause nausea. It can cause hypertension. And so, but literally all of these female hormone replacement type things, really, blood clots are a big risk. Okay, specific things about that estrogen progestin combo is that it increases the risk of blood clots, MI, DVT, stroke, and PE. It also increases that ovarian cancer risk. Oral androgens, we're going to dive into here. And so biochemically, hormone replacement can be used in some breast cancer, puberty promotion in boys, notify the provider if the patient appears jaundice, okay? So some of these can be really hard on the liver. So when we jump into testosterone in particular, we're going to look at it being used in hypogonadism. That is for, if we have an older patient, it can be used with that. It can be used with delayed puberty and testicular failure, and then also in some of the breast cancer, some types of breast cancer, okay? When applying testosterone, do not swim until 6 hours after application, okay? So we need to teach our patients this. If they swim within that 6 hours, swimming then, it's dissolved into the water and now it has been administered to everybody in the pool. So don't swim until 6 hours after application. Do not apply it to genitals. There will be blood draws for monitoring. And do not have skin-to-skin contact with a spouse and that region of skin directly thereafter, okay, especially that 6 hours after, okay? We want to teach the patients about these. Some really adverse effects we want to be aware of. They can increase the size of the prostate cancer. They can cause liver toxicity, and that's why we would notify the provider if the patient appears jaundice, right? Hold, notify, and let the provider decide, right? Edema and weight gain can be a side effect, and then gynecomastia can be a side effect. This is the equivalent of quote unquote man boobs. So it's not, the gynecomastia is the least dangerous, right, of the things that can happen with that, but it's also very embarrassing for people sometimes, right? So thyroid medications. So if you remember back to hypothyroidism, the end products coming out of the thyroid to stimulate metabolism are not present, right? Or they aren't present in high enough amounts. So our feedback mechanism, kind of the whole mechanism itself up in our brains kind of panics and makes a ton of TSH. So we end up with a lot of TSH in our system if a person has hypothyroid, right? And so your typical hypothyroid is going to have that high TSH from what I call feedback panic almost, right? And so the thyroid medication levothyroxine is replacement for your thyroid hormone deficit. So it's given for hypothyroid. Therapeutically, we want to see that TSH come down. We also, a lot of people come in because of being tired all the time, because of gaining weight. Those are really some of the biggest things that people come in with, right? And so go back and make sure that you fully understand from your pathophysiology, that you fully understand how hypothyroid and hyperthyroid work, The major adverse effects from levothyroxine or Synthroid are from basically the medication kind of overdoing it, right? So the medication it's almost like it causes hyperthyroid if it kind of overdoes it. So headache, irritability, insomnia, abdominal cramping, diarrhea, tachycardia, dysrhythmia, heat intolerance, if that medication, sometimes it's just because the medication is too high a dose for that person, and diaphoresis and menstrual irregularities, right? Oftentimes when we give this medication, it's early in the morning, well before breakfast, at least 30 to 60 minutes prior to breakfast, and on an empty stomach, okay? So our circadian rhythms like the morning with that medication, and our absorption really wants to have that in there on an empty stomach. We want to have it in there before we start eating for the day because we want our metabolism to be impacted before we do that. There's all sorts of good reasons why we're giving it early in the morning. All right, so I'm going to stop that one.